Hi all, hope each and everyone is doing well and good, and it is me Dr. Amrita here. So today we are going to discuss about the important topics in orthopedics, the must know questions and the 100% chance question. So if you go with an analysis from the 2019 onwards, we can see that till the last year, we can see that yes, definitely there is a question from bone tumors. So if you are planning to start ortho, I will say that first study well this bone tumors, because every year there is a question. So in 2023 there was a question like is on a clinical scenario, and also they have put an x-ray of what aneurysmal bone cyst. So at that time everyone was confused whether it is an aneurysmal bone cyst or is it GCT. So you want to study the clinical scenario, like how they frame it, what is the age group and everything. So how can you distinguish whether it is GCT or aneurysmal on the basis of the X-ray? So in aneurysmal bone cyst, the metaphases, it is unfused. It is just look at the X-ray, you can see it is unfused. But GCT is not like that. Okay. So there are certain catchy points, and please do MCQs based on bone tumors. 100% pakka there will be a question. You can expect a NEET PG 2025. That all that symbol bonds, just how they look in that X-ray, things you want to learn. This osteochondroma, osteoma, and that enchondroma, fibrous dysplasia, that is Murphy syndrome. That was asked in 2022. So this area is very all-time favorite. Definitely there will be a question. So bone tumors, please learn in and out, as well as the GCT aneurysm. I have already explained that spot spine. Fibrous dysplasia is all-time favorite, that shepherd group deformity that you want to understand how to find out in an X-ray and all. Please learn it in and out. Okay. So after learning this bone tumors, just understand all time there is a favorite question is from that dislocation wala. That is the hip dislocation. They may ask you whether it is an anterior dislocation or is it a posterior dislocation. So what happened? Yes, in femur, that is femur dislocation. If it is anterior, it is faber. There is abduction of the femur. Please learn it whether it is posterior. So they will put a picture, clinical scenario, and ask you to find out. So this is an all-time favorite question. So please don't skip it. Yes, that fracture one is very important. That neck of fracture, as well as that patellar fracture 2022 they have 22 and 23 they have asked, because in INA also it is going to be very favorite, that patellar fracture. Yes, on the basis of that age group. So what is that treatment part you want to learn, like in if it is an age more than 65 years, and if she have osteoarthritis, what is the treatment? Yes, it is total hip replacement therapy. So what is that is total you will be doing. And if there is no osteoarthritis, you can go with hemiarthroplasty. So according to the age as well as the arthritis, the treatment option is getting changed. Please learn it, because in 2023 we have a question, seen a question like in this thing, patellar fracture. Patellar fracture, what happened? This I have told about this thing about the fracture neck of the femur. I have just told, and also patellar fracture they have put like that the picture, and they will be asking you what is the treatment and all those things, because it's going to be very important. And also that Shenton's line, that is very important. So elderly patient fall in bathroom, that Shenton's line is broken. That will be the clinical scenario. So there will be what external rotation will be there, and there will be shortening. That's all. Please learn with the clinical scenario, because very important. So after learning that, go with the nerve injury, because nerve injury is all time favorite. See, there are certain chords now that median nerve. What happened? MNOP. There is things like what like pen test, pointing index, eighth deformity. That's all very important. So then after that, radial nerve. So where is that wrist drop is in radial nerve palsy, as well as where do you give that cock up splint. The splint pad, please, very important. See, your ulnar nerve palsy, what you will put that as a knuckle bender, and cock up you put in radial nerve. So please learn with picture and learn, because 100% sure definitely there is a question. See, card test, where do you do? See, what is the muscle you are testing? That's all very important. Book test, card test, agava from it. That's all you will be doing ulnar nerve. Okay, that treatment part. Hand, complete claw hand, partial claw hand. That's all things very important. Please learn with pictures. And after that nerve injury, because every time there will be a question, and after that nerve injuries, that general, all other general fractures, very very important. That olecranon fracture and all those things. This is what handshake. That is Colley's all-time favorite. The scaphoid fracture. That's all very very important. And also that tennis elbow wala and all those things very important. And after that learn metabolic bone disease, because that is also important. That codfish vertebrae, very important. Codfish vertebrae in osteoporosis, that dexa thing, that's all thing. And every time continuously they ask, one of the favorite question is that ankylosis spondylosis, that they will be giving, and to identify what is that x-ray wala. All time favorite. Multiple myeloma, very important. And salt and pepper skull, where you see salt and pepper skull, all time favorite question. Increase PTH and all those things. Multiple myeloma, that crab features, please learn. And ricket rosary, what is that? X-ray finding is very important. And also that vitamin D, PTH, what happens, like all those things. Now there is a table, please don't skip it. Picture frame vertebra, where do you see? Pages, this is very important. And also that arthritis wala, that rheumatoid arthritis, what all things features you are seeing. And also in diabetes, Charcot's joints is very important. Ankylosing spondylitis I already explained, because every time ankylosing spondylitis is very important. That bamboo sign wala, dagger sign, that's all very important. That swan neck deformity and all those things, please learn. Fracture, that is Gallacy fracture, Mondage's fracture. That's Bart's is there, Boxers is there, that and Colley's and all, Smith and all. Just read all those things with the x-ray, because any one of the question you can get. If they put Gallacy, it's very simple. Mondage's, that is one time 2023 I have put this thing, fracture, ulnar fracture they have put. So it is all time very important. And also yes, just read that hangman's, where you see hangman's, Jefferson. And what about that lower spine, that's all, just read and go. And also open book fracture, where you see, that's all roughly just read. And calcaneal fracture, where do you see what happened to that Gisani ankle, Bowler's ankle, that's all, just read and go. They might ask. So Smith, Colley's I've already mentioned, that is all time favorite, please never skip it. And again I will say that fracture neck of femur, that is treatment part, it's very very important. Like that patella is also going to important. So scaphoid fracture, how do you distinguish scaphoid as well as Colley's is very very important, please never skip it. So ortho is actually very easy. At the same time you can definitely say that 100% sure there is a nerve injury, while I will definitely be there, as well as bone tumor, there is 100% fracture, 100%. So, and also read all those things, and please don't skip it what I have already said. And this video and all, thank you all for listening me. And I'm planning to put the rest of the short subjects, because the poll results, most of them said that I need to put the important. So I'm planning to like shoot everything so quickly. So yes, next for other subjects I need to shoot. So it's me, Dr. Amla here. Thank you guys for listening. All the best for everybody.